Let's talk about some of the things that women tend to accept as normal, but that could indicate something more serious, specifically an abnormality that can lead to fertility troubles.
Heavy bleeding or flooding. Sometimes it's hard for women to know if you are a heavy bleeder. Because if you've always had heavy cycles, you may just think that's normal, right?
Right. Normal.
Or you talk to your biological relatives and they all have the same sort of thing, but that's because they're your relatives and you may have some genetic propensity toward heavy cycling. So if you're confused about or don't know if your cycle is actually heavy, let your doctor know, like how many pads you bleed through in an hour. If you're able to do activities of daily living, like go to work or drive in a car without ruining the seat. How many tampons you have to go through in a 24-hour cycle, that will help you to identify if you truly are having heavy bleeding. What I would also say about the heavy bleeding and flooding is it can be normal, but it's usually a warning sign that something is off. Maybe endometriosis, maybe fibroids. If you're in the right age range, it absolutely could be perimenopause. And another little tool to use if you're like, do I have heavy periods or not? If you're constantly struggling with iron deficiency anemia since you've become a menstruating person and you think your cycles are heavy, they probably are because you're just losing iron every month when you're bleeding.